can broaden our horizon, as we have surely saved the best for the last. Citizen News Service believes that community as central in driving health responses. Bret Miller is a courageous man who not only fought his battle with breast cancer, but also became determined and resolute to help other men who get diagnosed with breast cancer. He founded the Male Breast Cancer Coalition. We are very proud of you, Bret, and the MBCC, and the inspiring work you have done over the years. Well, salutes to you, to your courage, determination, and integrity to help the cause. Well, it's over to you, Bret.
Thank you guys for having me. It's an honor to be here. Tapping in from Kansas City. We'll get started. I'm a 6-year breast cancer survivor. And here's some stats for male breast cancers according to American Cancer Society for 2016. About 2,600 new cases of invasive breast cancer will be diagnosed this year. 440 men approximately will die from breast cancer. This is attributed to the late stages that it's diagnosed because men do not think that they can get breast cancer. Breast cancer is about 100 times less common among men than it is women, and the chances of a man getting it in his lifetime is about 1 in 1,000. And this is all according to American Cancer Society. So in the United States, this is not the world stats. So with that being said about some of the stats and everything, some of the risk factors for men are based on their age. Their average age, according to breastcancer.org, is 68. I was 24 when I was diagnosed. I was 17 when I first found the lump under my right nipple. I went to a couple different doctors at the time of discovering it, and each one said that it was a lump. It was from puberty. It was a calcium buildup. It would dissipate and go away, not to worry about it. Fast forward to current, as you can see, I am now a survivor and helping build the awareness for men. Some other factors can be family history, as everybody else has said, is hereditary. There's a 5 to 10% chance of it being hereditary. Environment is part of the other reason. The high estrogen levels in men's and or radiation exposure. But for me, it was not genetic. Mom and I both got tested recently on the new MyRisk test. It tests a much broader spectrum of genes, and there are still no genes that attribute to breast cancer for either of us. So with that being said, when I was diagnosed and I met with my surgeon, he was a great surgeon. He looked at me and he told me that he's never had to do male breast cancer surgery on somebody as young as I am. If I were to have any questions, he could try to reach out and get in contact with some of the men he had done the surgeries on previously, but most of them had done the surgery, taken time off work, and went back to work like nothing ever happened. Hearing that was kind of disturbing that there's no men out there willing to talk about this, and he told me that if I was willing to share my story, that he could see me being a face of male breast cancer and helping others. Hearing that from a surgeon that's been doing it for so long was kind of uplifting. So that's kind of how it all started. We started the Bret Miller 1T Foundation, which in turn helped with social media. We met Cheri Ambrose out of New Jersey, who formed the Blue Wave, and together we combined and made the Male Breast Cancer Coalition. The coalition, you can find us on malebreastcancercoalition.org, and over on there we have many stories of survivors from all over the world, and we continue to grow each day. We're here to support men, help them along the way, making sure that they understand what is coming in their diagnosis. You will be sent to a women's clinic to get your ultrasound or mammogram. You'll be given a pink gown. Everything is going to be pink. Don't be alarmed by it. It's just the way it is because this is a predominant disease in women. We're just here to help you out, support you along the way, ease it, and in any way we can help our survivors get the treatment that they need. There's been several survivors that have been denied treatments or medications from insurance, and we've been able to write letters and tweet and do everything through social media that have in turn changed their decision and helped our men get the medication that they need to survive. Here's a picture, if I go back to it, of our Male Breast Cancer Coalition homepage. And I'll go to one more little slide. Several years ago, I did, for the National Consortium of Breast Centers, a breast self-exam for men. There is also women's exams to properly show as a video instead of just picture slides of how to do a self-breast exam. So if anybody would like to go do it, it's breastselfexams.org, and all the information is on there. The link you can also find on our coalition page and up here and everything. So I think that's about all for me at this point and stuff. I'm willing to answer any questions if anybody has when we get to that point. So thank you for having me, and I'll wait for questions.
Thank you very much. That was breast cancer survivor and founder of the Male Breast Cancer Coalition, Bret Miller. Well, it's a good time to open the floor for questions and answers. Well, participants, please keep sending your questions using chat function or raise your virtual hand to request to speak. Let's begin the Q&A session. It's over to our Citizen News Service Managing Editor, Madam Shobha Shukla.
We have Diana Wangari from Kenya who wants to ask a question. Diana, would you like to ask your question?
Yes. Can you hear me?
Yes, you can.
Yes.
My question specifically is to Bret Miller. I'd first like to say thank you for sharing your story, and I'm actually moved by your dedication and effort to raise awareness on male breast cancer. So, in particular, from African societies and culture, you find that there's a lot of stigma. At the same time that men, survivors, are not willing to speak up, yet this is something that's actually being diagnosed in our hospitals. So I'd want to find out that what is an example that you could think of that in a situation on the ground that men respond to that could provoke a change in strategy that us in the African societies we might want to emulate?
Thank you. One of the what I've realized over the years and stuff is that a lot of men don't believe that they have breast tissue, and I think that's part of the problem. Everybody's got breast tissue. It's just to a certain extent how much you have based on your body, but it's erasing the stigma that it's that men don't have breast tissue. So it's making sure everybody understands that. And if it's comfortable for men to say that they have chest cancer or pet cancer or whatever it is to make them feel comfortable about the disease, they just then need to understand that it's still considered breast cancer in the medical world and stuff. But there are others out there. There's a support system out there. We're out there. There's other support system out there for them and stuff that they don't need to be ashamed of it anymore. That if you diagnose, if you detect it early and you can get to the doctor and you can get it diagnosed early and stuff, that you can survive this. If you let it go and be as a typical male and not go to the doctor until it's the last minute, or you're really sick, or if you break your arm or something, not being stubborn and going to the doctor early enough, that you can beat this disease. It is beatable, but you have to be proactive in getting to the doctor. You are your own best advocate for knowing your body, but the doctor will be the one to diagnose you and tell you that it is breast cancer. And along the way, one of our survivors, Michael Singer, he's in the Bronx, New York. I was on the Katie Couric show. It's about 3 years since I've been on there. But he was 2 years diagnosed, and he didn't speak about it at all after during his diagnosis to when he saw me on the Katie Couric show. His wife actually called him into the room saying that she was watching it and had I was on, and then he sat down and he watched it, and literally that next day after it being aired, he had contacted us and stuff, and he was like, I'm so proud of seeing somebody else as young as you, Bret, for speaking out that that I'm not ashamed of this anymore and stuff. So he's been a very pronounced advocate in our society for Male Breast Cancer Coalition, and he was affected personally not only by himself being diagnosed, but his sister had died from breast cancer as well. So he is very adamant in our community now. So it's great to hear my story helping others. It makes me feel better. It makes me keep wanting to keep going and not stop until we can change the stigma and put a little splash of blue in the sea of pink, as we always say, at the Male Breast Cancer Coalition.
Thank you. Thank you.
Thank you. Thank you, Bret. There is a question from Pakistan for, I think, Dr. Ramakant and Dr. Mishra may be able to answer. What is your recommendation for screening for early diagnosis for women, men, and transgender people? Bret shared that he had the first symptoms at the age of 18 years. So what is the recommendation for screening for early diagnosis, at what age? And also, for Pooja and Dr. Mishra specifically, what is the average delay in diagnosis for your patients in a country like India, in hospitals where you have been working?
So I would like to start with the second question. So there is usually a delay, and then if you see, I have stressed on the ABC of the breast health. There is no alternative pathy. So some of the patients, when we diagnose breast cancer, they do not continue with the treatment with our advice. They go to some alternative pathies, and then they develop from early stage, they advance to locally advanced stage, and then they come back. We usually see delay, and delay is usually 6 months to 18 months. It varies. If you see, we are a referral hospital, so we cannot give you the exact data because sometimes we get patients from different hospitals. We get diagnosed patients from different consultants, gynecologists, general surgeons, or physicians, or referral people. So exact data we cannot tell what is the delay, but there is definitely a delay after the diagnosis in many cases. And then the first question was a symptom and 18 years of age, and then screening. So I think it's just self breast examination. She should have a clinical breast examination from a doctor, and then at that age only a breast ultrasound is sufficient to see if there is any abnormality in the breast. I think that gives you the answer.
Okay. Dr. Ramakant, thank you, Dr. Mishra. Dr. Ramakant, would you like to add something?
Yes, screening recommendations as per the guidelines, they say to have annual mammogram after 50 years of age, and biannual, that is once in 2 years after 40 years of age. That is the US guidelines which they quote. But the problem in India is that we see patients in late 30s and early 40s. So if you start doing the mammogram after 40 years or 50 years, then that is too late for the screening. That becomes more diagnostic. So we don't have, unfortunately, we don't have Indian guidelines to say that when should we start screening. But ultrasound is done before 35 years of age, as breast is very dense before that age, and mammogram to be added after 35 years of age. So that is the US guideline which I told you. Indian guidelines are slightly like opportunistic screening. That is, high risk people who come to the hospital, we screen and do imaging. And for transgenders, there is no as such recommendation guidelines for them because the data is very scanty and it's very scarce. So there are no large number of patients who have been diagnosed to make a guideline for them. But I think everybody should do self-examination, starting the moment they become adult, like 18 years onwards, and add a mammogram once they are 40 years plus. And if somebody is high risk in the family, somebody got cancer, they may start at 30 years or 35 years itself.
We have Cheri Ambrose with us, who's the co-founder of Male Breast Cancer Coalition. Cheri, would you like to make a comment?
I think I've been sending a few through. This has been a great panel. I thank you so much for including us. We are here for all men around the world. We want awareness to begin with the medical community. I think a lot of times some of these men present symptoms to the doctors, and the doctors actually give them a salve or a cream and tell them, you know, see me in a week, it'll go away. We hear that all too often. So that's why I've been saying it begins with the medical community. We also need, I know here in the United States, we need our insurance companies to be educated as well. Because they are going by very, very old rules when it comes to covering these men. A lot of them are losing their houses, they're losing their jobs, they lose their families because they basically go bankrupt trying to pay for the medical treatment and the drugs. And this is not happening with the women because the women are covered. So there's a lot of, I can understand why the men are reluctant, because not only is the cancer beating them down, but also trying to pay for it, and it's just, it's really terrible what's happening to them. So we are here to support them. We are here to be a voice for them and advocate for them. We are also involved with many of the large cancer organizations here in the United States. We are partners with the Metastatic Breast, we're actually members of the Metastatic Breast Cancer Alliance. We partner with Breast Cancer Research Foundation. There's a whole host of them. So we welcome anyone to come to our site, and that includes members of the transgender community as well. If we can help, we certainly will try.
Thank you, Cheri, because I was about to ask you that does your coalition intend to work with the transgender people as well? But you have already answered it. Thank you so much for that.
Okay.
Thank you. Ashok Ramsarup, our today's moderator and award-winning journalist and former senior program producer of South African Broadcasting Corporation, wants to ask a question. So,
yes, thank
Ashok,
you very much indeed. Thank you very much. Firstly, I want to thank Mr. Bret. He should be lauded for his honest and eloquent discussion on breast cancer. He actually made me aware of what's going on in the world.
Okay, before we end, I would like each presenter to make one quick point in as less a time as possible. We have already exceeded the time by 2 minutes, but starting with Priya, just one final point. Priya, in any order, Priya, Dr. Ramakant, Dr. Mishra, and Bret.
So I say ABC of the breast health: awareness, breast examination, self-breast examination, and anything is there, a clinical breast examination by a doctor.
I'll say stay healthy, please exercise, and don't be obese.
I would say that we have to address the non-health risk factors and look at multi-sectoral partnerships outside of the health sector.
Thank you. And finally, Bret, the star of today's.
I will just go simple and say the two slogans that we have. The one for the Bret Miller 1T Foundation is, guys, don't be afraid to touch yourself. And for the Male Breast Cancer Coalition is our hashtag Men Have Breasts Too. So be sure to check yourselves and get to the doctors if you find any lumps or anything that you're afraid of.
Thank you. And finally, Ashok Ramsarup, our moderator. What would you like to say?
Thank you. Well, what I would like to say, I must thank the entire panel. They've been so great. Actually, you made me aware of the importance of breast cancer, not only to me, to my entire family, and I think to the rest of the world. I think we need to know more about breast cancer.
Thank you so much. And thank you to all our panelists and participants. As always, we will be sending the recording of the webinar to all of you. Have a good day.
Thank you.
Thank you.
Thank you.
Okay.